Less than 2 months to go before kids are back in class. It feels like summer just started. Ontario's Science Advisory Table now releasing guidance for how schools should operate when they reopen this fall. Joining me now with details on the report is President and CEO of SickKids, Dr. Ronald Cohn. Thank you so much for joining us yet again, Dr. Cohn.
Good morning. Thank you for having me.
Let's get right into this report. And the big piece here is that a number of experts, including support from SickKids, saying kids should be back in the classroom, good for mental health, good for a number of reasons. But all of this is hanging on the idea of what is happening with the COVID-19 situation. Why is it so important from the SickKids perspective that kids physically be back in?
So I think if you look at Ontario in the last year, our children have been really out of school longer than in any other jurisdiction. And we know that in-person school is really the essential place for children to be. It's like the essential workplace for children. So we put this guidance document out with different scenarios depending on what the epidemiological situation is, in order to ensure that children can not only go back to school, but also stay in school, and that we are not using school closures as a lever for pandemic control unless we really see some catastrophic circumstances.
Dr. Cohn, there's a lot of factors at play here. One of the pieces that we're hearing from the education minister will be the upgraded ventilation system, potential masking policies, but keeping up with the hand hygiene and so on and so forth. But when it comes to vaccinations, it's interesting, right? Because only 12 and above are allowed to be vaccinated. For those who are under 12, and I'm a mom to one that's under 12, and there's concern there about how to keep these younger ones safe when we don't have an approved vaccine. What is your take on that?
So I think it is really going to depend on what our situation is going to look like come September. So if our disease burden, and which means if we don't see a lot of patients in the hospital, in our ICU, together with low case numbers, then we can send children back to school even without some of these temporary measures being as strict as they are. Having said that, if the disease burden is slightly higher and we do see a slightly higher transmission in the community, then we have all these permanent measures that you were referring to, like air ventilation and filtration, and also making sure that we don't send children sick to school if they don't feel well. I think we are all guilty of this, and it actually is a change we all have to do in society, not going back to school and or to work when we are not feeling well, plus these temporary measures that can be layered on in order to ensure that it is safe even for the children who are not yet vaccinated.
All right, we have run out of time, but indeed, we have, I'm looking at the count, I'm looking at the calendar, about a month and a half before school is set to take place. A lot can change between now and then, and indeed recommendations can be tweaked, as you mentioned here. So we'll have you back, Dr. Ronald Cohn, to see where things stand as we approach the school year in September. Thank you for your time today.
Thank you for having me.
All right, have a great day. It is 7:10 right now. We are checking in with Dina and Sid. You guys are upstairs in the haze.